The following mindfulness practices are intended to be used as part of the PICS Living Well with Pain programme, or they may have been recommended to you by your clinician as part of your individual pain management plan. Either way, please begin by listening to this introduction so that you can get the most out of the practices that follow. Starting mindfulness practice is not always easy, and finding a time to commit to the practice can be a challenge. The time of day you practice is up to you and will depend on your routine and lifestyle. Regularity is key, so it can be useful to plan when you are going to practice and build it into your daily routine. It's best to practice every day if you can. However, if you don't manage to, try not to criticise yourself. Just see if you can get back on track as soon as you can. Often the times when we feel too busy, overwhelmed, or not inclined to practice are the times we would benefit from it the most. Sometimes people feel taking the time to practice is self-indulgent and they should be doing other things. In fact, quite the opposite is true, and it can be of great benefit to you and those around you, as it's a practical way of dealing with your pain and other difficulties. You may want to consider where you undertake the practices. When beginning, it can be helpful to choose a quiet place where you won't be disturbed. This may mean telling others what you are doing and putting your phone on silent. For these practices, you may choose to sit in a chair or lie down on the floor or bed. In mindfulness practice, we are training ourselves to be more aware, more open, and kinder to ourselves. Making a definite change in posture can help signify stepping out of automatic daily routines and stepping into the present moment. If sitting, for example, placing both feet on the floor and sitting with the spine upright but not tense. Most importantly, make yourself as comfortable as possible before you begin. Sometimes using cushions or pillows to support parts of your body can be useful to maximise comfort. It's also important to make sure you are warm enough so you can always cover yourself with a light blanket. You may choose to close your eyes or just soften your gaze and focus on a spot on the ground a few feet in front of you. It's quite common to become sleepy during practice. If this does happen, it's not a problem, although you may want to think about how you respond. You could choose to open your eyes or change your posture. Alternatively, you might choose to accept with kindness that you are sleepy right now and see this as an opportunity to take some much needed rest. If you continue to feel sleepy each time you practice, you might want to choose a different time of day to practice or keep your eyes open so that you have a different experience. Mindfulness is not difficult or complicated, although it does require some effort and persistence. The process of becoming aware of the busy mind and the sensations in your body can be challenging. It requires being open to trying something different. Try to let go of any expectations about what the practice will do for you and see if you can just try to do it with an attitude of openness and curiosity. Always feel free to discuss any concerns or difficulties you are having with your pain practitioner.